You might have been hearing a little something about this. So the CDC is warning doctors to be on the lookout for measles.
Since early December, 23 cases of the highly contagious virus have been confirmed here in the U.S. Let's bring in Beth Galvin with our Fox medical team live to talk more about this. Beth, why are we seeing an uptick? What do we know about the cases?
Oh, so good morning, Sally and Lena. So right now there are ongoing measles outbreaks in every region of the world, the CDC is saying, and they believe that these cases here in the U.S., you mentioned that, the U.S. was declared eradicated of measles in 2020. I'm sorry, in the year 2000, so 24 years ago. But what is happening is we're seeing small clusters, small outbreaks. The CDC says this is due largely to travel. So this is people who are flying into areas where they do have ongoing outbreaks, and that can be Europe, that can be the United Kingdom, and then they're coming back into the United States, and there are typically a couple of themes here. Typically these travelers are Americans, according to the CDC, and they are unvaccinated or under-vaccinated against measles, and then they tend to be passing it on to clusters of either children or teenagers who are also unvaccinated. So the CDC is really warning doctors, hey, and healthcare providers, hey, be on the lookout for this for patients who are coming in who have this, typical measles fever and other measles symptoms, and have a history of travel outside the country in areas where they might have been exposed to measles, and then isolate those folks and treat those folks and report those cases so that we can stay on top of this. Fortunately, because we do have a really high level of vaccination in this country, we're not likely to see this really big outbreak. Again, it's going to be probably little clusters of cases here and there in mostly people who have not been fully vaccinated.
But we were showing the other symptoms there of measles, but you know what, I was looking at the vaccine for that. We probably all got it when we were kids or younger. As adults, you said under vaccinated. Do we need to get another, I don't know, a booster at this point, or are we all good?
Well, so you typically with the measles, mumps, and rubella vaccine, the MMR vaccine, you get 2 doses. So if you are getting ready to travel, the experts are really saying make sure that you are fully vaccinated, that you've had, both doses. If you have a child, like a baby, you may need to talk to your pediatrician because they may need only 1 dose. But find out and make sure that your child has and is fully vaccinated appropriately for their age before you or they travel outside of the country. But the good news, Sally and Lena, is if you have 1 dose of this vaccine, you have 93% protection against this virus. If you get both doses, you have 97 to 98% protection. This is a very effective vaccine and can provide a high level of protection for you. The question is just making sure that people have this if they're going to be traveling out of the country.
Okay, Beth Galvin with our Fox medical team. Thanks so much for the heads up and the good reminders.
Thank you.
Have a great day.
Thank you, guys.